Revision of a DIEP flap reconstruction involves tightening and adjusting the skin and contouring the underlying fat. So there's two maneuvers that I generally do to achieve these goals. When it comes to tightening up and adjusting the skin envelope, that involves removing scars, cutting out extra skin, tightening up the skin, essentially tailoring your skin to improve the overall shape of the reconstructed breasts. And this tailoring is generally done along the existing scars that you already have. As far as improving the overall volume and contour of the breasts themselves, that involves a combination of removing fat with liposuction and adding fat where you need it, so fat grafting. So that usually summarizes the revision of a DIEP flap reconstruction. We're sucking out fat from areas where you don't want it, adding fat to areas where you need it, cutting out areas of extra skin, and tightening up the skin on your breasts, your abdomen, your armpits, wherever there's all that loose skin. We'll get rid of that extra loose skin, and we'll also suck out some extra unwanted fat and use it to further contour and improve the overall shape of your reconstructed breasts. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.